Ketamine has been used for emergency room procedural sedation even in children who are less than 3 years of age. I must say something over here. Usually in children, conventional anesthesia is not given. The reason for this is that studies have shown that children who receive conventional anesthesia, particularly very young children who receive conventional anesthesia, are more likely to have cognitive deficits in later years than children who have not received anesthesia. And children who have received anesthesia on more than one occasion are even more likely to have cognitive deficits. So, conventional anesthesia is preferably avoided in children, but ketamine is a little bit of an unconventional anesthetic drug. Ketamine does not suppress respiration as conventional anesthesia does. Ketamine does not suppress cardiovascular functioning. In fact, ketamine even facilitates cardiovascular functioning. The heart rate and the blood pressure slightly increase when ketamine is given, and how much it increases will depend upon the route of administration and the speed of administration. So, it is generally considered that ketamine is less likely to be associated with cognitive deficits after administration. It is considered to be safer for use in pediatric practice than conventional anesthesia. As an example, in a country like Singapore, which is so highly regulated, as far back as in 2020, a retrospective study noted that more than 5,000 children, nearly 5,500 children had been treated with intramuscular ketamine for procedural sedation in the pediatric emergency room. Just think of that. More than 5,000 children treated with intramuscular ketamine just for procedural sedation. That is how safe ketamine was considered to be. Repeated dosing with ketamine in children has also been described up to 42 times across 4 months, depending on the need for ketamine. If they can do this, you do not need to be afraid of using ketamine. I'm telling you all this because if you are challenged by anybody, it may be a colleague, it may be somebody from a different medical department, from a different healthcare discipline, or by an administrator, you have a wealth of information here to justify how people are using ketamine across the world, and therefore why it is okay for you to be using ketamine to treat depression, for which we now have nearly 25 years of world literature. Hello everybody, my name is Chitkanjan Andrade. I am a psychiatrist. I used to be working as a senior professor in the Department of Clinical Psychopharmacology and Neurotoxicology at the National Institute of Mental Health and Neurosciences in Bangalore. I retired from service very recently, and presently I'm working as a guest faculty for conceptual psychiatry. I have a series of lectures for conceptual psychiatry, and you can access these lectures at the Conceptual Psychiatry website.